Steve, thank you for such a warm introduction. And I'm thrilled to be here with so many nursing and midwifery colleagues today. I'm very grateful to the Nursing Times for this first digital forum, hopefully the first of very many. It's great to see such a breadth of events being offered to nurses now. It used to be quite niche. With just a few nurses interested in digital technology attending forums and conferences that weren't specifically for them. But this is every nurse's business. And so it's really great that we're starting to reach out, both in your publications, but through forums like this, and give people the opportunity to learn much more about this and share and learn together. And I'm really excited by the agenda that you've put together today. Our collective voice is really, really important. And it starts with being at the decision making table. And that's why, as we talk about what good looks like, we'll be talking about why we focus particularly for this piece of work in our wider culture building work on chief nurses, and why it's really important that I was appointed as CNIO for England back in March 2020, right at the start of the pandemic. An interesting time to start a new job. But really, I'm really delighted to be a voice for nursing at that table. But my job is to empower all nurses to use their voices. And events like this are a really important part of achieving that. I'm joined by Andrea today, as you mentioned, Andrea Lewis, who is a chief nurse at Ashford and St Peters and has been invaluable in leading a group of nurses, midwives, and patients to shape our What Good Looks Like framework, a real toolkit for chief nurses to use as they start to think about the breadth of things that they need to consider when they're doing digital transformation. So starting with that leadership role, and it's great to see that we are growing our CNIOs, but so much more. So Andrea will be telling you about that. But I'd like to go back in history a little bit and just set the scene for the audience today. So if we can go to the next slide, please. So let's talk a bit about context. I don't need to tell everyone here how important we are as nurses and midwives in driving and positioning digital change. But you mentioned the pandemic at the beginning, and clearly that was a real turning point. But this has been going on for much longer than this. You know, digital technologies and data science have been emerging in our practice for many, many years. But what we know is often nurses and midwives have been digitally done too, rather than taking this leadership role. And there's some key policy documents that really steer the evolution of digital transformation and taken us to this key point in our nursing history. So the WACTA review clearly called out the need for all healthcare professionals to be prepared to lead this agenda and talked about what the future might look like. The RCN went on to talk about every nurse being an e-nurse, which is a really important message. This isn't for the few to lead. This is about every nurse's and midwife's practice. And they really need to be empowered to not only practice in a digital health and social care system, but to take up those leadership roles and say what it should look like. The long-term plan set out a future for the NHS and importantly said this couldn't be delivered without digital technologies. I would challenge anyone trying to do any improvement of process or pathway in today's NHS without bringing a digital or data component to it. The Topol review went on to talk a bit more about how we prepare our workforce for the future. And one of the limitations of that review was the fact that there was very limited nursing and midwifery voice in there. So it talked very much about AI and genomics and what they might bring to future of healthcare, but was so broad brushed that it was hard for nurses and midwives to understand what that meant for them. And that's why we have commissioned the Phillips Ives review, a review that I co-chair with a really super international co-chair, Jeanette Ives Erickson, who is the chair of the Magnet Nursing Excellence Commission and was the chief nurse of Mass Gen Hospital in the US. So a real focus with international and national nurse leaders working as a global community to really articulate what will our future look like in 5, 10, 20 years. Last week, I spent 2 days working in workshops with the chairs of the panels for this review, and it's really exciting to see what they're up to. There is a website that you can visit, Philips Eyes Review, where there's a crowdsourcing platform that you can share your experiences, your case studies, your ideas, and your challenges. So I'd urge the audience today to go and visit that website and make sure that you are heard, so that results of the review are really clear with really strong recommendations that I can use in my position to ensure policymakers pay attention and we deliver the workforce that we need for the future, who are truly prepared for the healthcare that has digital and data at its heart. DHSC went on to lay out its tech vision, and of course, we have the people plan. But fundamentally, the strategy for technology is to digitize services and then connect them to support integration. And through these two foundations, enable transformation. If we can go to the next slide, I'm going to say a bit about the principles, the design principles for our profession and why this is important. So it's all very well saying let's all digitise, but we're not digitising for digitisation's sake. So the unique role of the nurse is their ability to join up care. We spend a lot of time handling information in order to enable that seamless transition across patients' care pathways all through the system, through the acute, through community, primary care, and into social care. And we spend too much time looking for information. So at the heart of the change needs to be technology that supports us to do that joining up role in a seamless way and spend more time with our patients. It's really important, as I said, that you are empowered in order to do the design for that future. The professionalism of a core group of nurses is important. We have a specialist workforce spearheaded by chief nursing information officers who are at the top of that profession, but have teams underneath them of varying size of nurse informaticians, and we clearly need to grow that specialist workforce. But as well as growing it, we need to be really clear about what that specialty is, just like we would for any other nurse specialism, and make sure that the education to support them is right to enable them to lead us. We absolutely have to reduce the documentation burden on nurses. We spend the most time with digital documenting care, either in paper or in digital, but that is where we spend a lot of our time, and we need to reduce that burden, and so build digital tech that enables that rather than makes the situation worse. In so doing, we release time to care and improve safety. And the exciting thing about going digital is the data, the wealth of data that's at our fingertips that enables us to really improve safety and think carefully about what we could do differently. That data and the whole package of activities that we need to do as nurses, those principles ultimately empower people, empower patients, and we have a unique role there. As the most trusted profession, we are the people that patients turn to explain the situation that they're experiencing when they're experiencing healthcare. And so we need to think really carefully about our understanding of digital and data in order to enable us to fulfill that important advocacy role. If I go to the next slide, I'm going to talk a little bit about what we learned when we did a digital maturity assessment back in 2021. And we've just rerun that assessment and we'll be publishing the findings in November. I'm pleased to say that we have seen some improvements, but there's a long way to go. We still have these 4 key themes to address. So we surveyed across the country, and you can see on the left the responses we had. So we surveyed all provider organisations and had a pretty good response rate. But what we learned is, unsurprisingly, probably to many of the audience here, we have significant variation in the people leading this in terms of the banding, the job descriptions they have, the sorts of work they do, the career progression they have at their fingertips, and who they're accountable to. And that affects their scope of influence, which affects how well they can do the job. So we need to tackle that. We noticed that people have real variation in how they're educated and prepared, either to lead this agenda or just to practice just basic digital literacy. And so through the Philips Eyes Review, we aim to come up with our education strategy in order to start to address this in the coming years. Of course, unsurprisingly, real disparity between organisations in terms of digital maturity and a real lack of standardisation around processes and competencies. And through our work on standardisation, we know that nurses are asking us to do this. So this is an area where we need to address it centrally, but equally you need to address that locally in your own areas. And that and our research agenda are dependent on having the right leadership, the right education. So those are fundamental to the way we're working. So drawing on that leadership theme, if I skip to the next slide, I'm about to hand over to Andrea, who's going to talk us through this guidance for nursing on what good looks like. So we realised we needed strong leadership. We realised our digital nurses weren't in a position to lead, and we realised the most influential people here are people like Andrea, chief nurses. So we co-designed some guidance to enable them to think more broadly about what they would need in place to be able to fulfill that leadership role, to build really strong digital nursing organisations. So over to you, Andrea, to explain the process that you went through and what's in this guidance for our listeners.
Brilliant. Thank you, Natasha. And firstly, I'd just like to say it's lovely to be here with everyone to be able to present on this piece of work. And also, secondly, to say it was a real pleasure as a chief nurse to be part of this programme. You know, recognising, as Natasha just said, the key role that chief nurses need to play really in helping shape the leadership point from the transformation in the digital nursing space. So I was the chair of the What Good Looks Like Delivery Advisory Group, and we were, again, I'm very proud to say that we were able to shape the guidance and what you see today. And the start of this, in fact, we need the next slide, sorry. That's brilliant. The start of this was the discovery phase, and you'll see that on the slide there. So this was a really important step in setting out what was considered important to digitally transform from a nursing perspective. And as the slide highlights, the discovery phase, in order to do this, this discovery phase used one-to-one interviews, it used group interviews, it used workshops, and it utilised a diverse group of expertise and experience from across primary healthcare, secondary healthcare, mental health. We had a chief nurse from the ICS, academia, community, Health Education England, NMC, social care, and also patients. So really, really diverse, actually. And what this enabled us to do and achieve was to get a really rich insight and intelligence, really, for sure, in what we felt was needed and what ultimately has helped produce what we have today in the line of in the guidance. One of the key things that did come out, actually, and you'll see that on the slide, is that the guidance for nursing, it was felt really important following the user research that our guidance for nursing should align to the parent programme, which did come out in 2021. And so we have used, you'll see as you look into the guidance, we have the 7 measures that you'll see in the circle there. And that very much, as I say, aligns with the parent programme, which again makes it, has that great synergy aligned to it. Can we have the next slide, please? So these are the 7 success measures in a little bit more detail. And what this highlights is really around each of those 7, what this guidance means for us as nurses. But I'm only going to pull out a couple in light of time. And the first one I'm going to pull out is the well-led. Now, for me, I feel that, you know, if we can get this right, this is the foundation and the bedrock for transformation. And getting this right is really, really important. So what this means really for us, and I'm speaking obviously as a chief nurse, you know I have a very key leadership role in leading on the nursing digital transformation piece, but also in being able to execute this guidance with my digital lead, which is what I'm doing within my trust with my own CNIO. So the bit here, really, to bring out some examples, is about having a strategy, but making sure that, you know, that nurses within the organisation are involved in setting that strategy. It's about having the right culture, which is supportive. And from a board perspective, that you have a line of sight, really, for me as chief nurse, as to what really is going on at the front line with our nurses or at the point of care. It is about having a digital nurse leader within your place of work, who then feeds into the chief nurse, but also whoever the digital lead, overarching digital lead is for the organisation. So, for instance, I do have a chief nursing information officer who I line manage, but actually that individual has a dotted line to our digital information officer, our digital lead for the trust as well. So we have that lined up approach. And the key thing here is about having that multidisciplinary aspect to it. The next bit I wanted to just pull out is about safe care, or safe practice rather. Now, this is really important, and I think, this is about ensuring that we've got consistently safe processes and systems in place, not just within the organisation actually, but across the ICS as well. And you'll see from the guidance, it has, the guidance does illustrate actually what really good looks like for both an ICS and an organisational perspective. But the so what around this is that nurses, are the ones are providing the care at the point at that initial point of contact, and it's about providing the best possible care, but with the lowest risk as well. So it's about nurses understanding, digital clinical safety and also information security as well. It's about them understanding the clinical safety standards, and we have links within the guidance to highlight all of that. And a key bit as well is about identifying the digital clinical safety incidents. So incidents that will crop up, and undoubtedly they will crop up, but it's about understanding what those issues are, what are the mitigations, and what's the learning from that as well, in order to sort these bits out. And it's about having a clinical safety officer, and we do, in my trust again, we have a clinical safety officer appointed, and that's actually a doctor who does that. So a key thing here is about the feedback loop around all of this, knowing the issues, knowing what any safety alerts come up, but also having the learning and mitigating that accordingly. Next slide, please. So I just, obviously a key thing for us is that we want you to look at the guidance and familiarise yourself with it. It is on NHS Futures platforms, and we'll have a link for you to be able to get to download that. For me, I think it's really user friendly. There's no two ways about it, and it's wonderful in that it clearly articulates and is explicit about what, as it says on the tin, what good looks like really from a nursing digital transformation perspective. We do have a support offer though, really, because it's all well and good producing the guidance, but it's about having, the next steps and what's in support for people as well. So you'll see on the slide here other bits that we're working on to help really land this well. Organisations have started running and started doing their sort of a self-assessment as to where they are with regards to the guidance and what they need to do, and from that there's an action plan coming out. But we have got other support pieces here. So there's we're doing an education package for chief nurses. Natasha and I went round the country and spoke at the regional chief nurse forums, and had the pleasure of speaking to lots of different chief nurses. And what did come out there was actually they felt that there was clearly an education gap for them, and that's hence what's led to this package being developed for them. We'll get masterclasses or webinar series that are being set up, and we've had some of those already. But there's best practice case studies, lots of great stuff, and there's more actually on the Futures platform. So I would definitely get you guys to have a look at that, because obviously this presentation is just the start really of this journey for those who are interested in this and want to take it forward. So the Futures platform is a brilliant resource around that. So if we go to the next slide. There you go, brilliant. So that QR code sets out really, if you can zap that, and it takes you to the guidance and links you in. So all good. So I'm going to leave it there actually, because obviously we're really keen to get any questions from you guys, both for myself and Natasha to answer and to have that interaction. So I'll leave it there.
Good morning to you both, and thank you for opening today's event and for such a rich presentation. It sounds like there's a lot going on, which is great to hear. So remember, audience, now is the time to get your questions in using the swap card, and then I can put them on your behalf to our speakers. That's the same throughout the day. Just before I get going, because we've already had a couple in, which is great, just to kick off, Natasha, you and I were both at the CNO Summit last week. Looking nationally, are you happy with progress on involving nurses in digital transformation at the moment?
Great question, Steve. Thank you. And it's a difficult question to ask me because I'm never happy. I never think we're going far and fast enough. But in reality, yes, I don't think this was ever an agenda where you would, turn things around in the space of a year and say, here's the career framework for our specialist workforce. We now have one in every organisation, that everyone's got an EPR that meets the needs of nurses. This is a long-term ambition. But I think we have come a long way in the last 2 years. And certainly our annual digital nursing assessment shows us that. So we have seen an increase in the number of CNIOs. We have seen an increase in the right direction in terms of where they're being banded and their reporting lines. And we've seen an increase in the size of teams. And really, without that workforce, it's really hard to deliver for the rest of the workforce. We see a real commitment from our chief nurse, Ruth May, who had the vision to appoint a CNIO, which really set the tone. And I see a shift in our chief nursing colleagues who are really starting to grapple with this agenda on top of the already busy agendas that they have to grapple with. It's not enough to go to the board speaking for nursing as a nurse and a nurse expert. You need to have a grip of the finances, estates and facilities. And now we're saying, can you have a grip of digital and data science? And that's a big ask. And I'm really pleased to see how they're stepping up. And I think through that community, we can help the whole of the workforce. But we can't be complacent. There's a really long way to go here. We've got some stretching targets nationally in terms of levelling up with EPRs, and we're chasing that train, trying to have done the nursing work in the background, ready to be ahead of the EPR, which we won't. But I'm really heartened by some of the nurses I see out there who are really taking a grip of it and saying, this is how we want to design our digital systems. We're seeing nurses leading the virtual wards in swathes, and they're super exciting. I'm sure you're going to hear much more about that from other speakers in the next 2 days. But broadly, yes. Could we go faster? Always want to. Is this a long journey? Yes.
Brilliant, thank you. And quickly to Andrea, looking at trust level, obviously you mentioned the 7 success measures, being supportive and all the leadership reporting lines and things like that. But if there was sort of one key message that you wanted to give other people like yourself, other chief nurses, and I guess their CIOs as well, on making progress and bringing teams along with them, would there be one particular thing that stood out for you?
I mean, another great question. So I suppose the key thing for me, from a nursing and midwifery perspective, that in order to ensure success or tee things up for success, it's really important to bring all the team with you right from the start. So for those of you out there who are embarking maybe on a new electronic patient record, get the teams involved now in having those discussions in order to shape that successfully. And then from a trust executive perspective, for me, it's about having those really good conversations with your fellow executives in order to again get them all aligned. I've got very supportive fellow executives on this agenda, and we're just going through a new electronic patient record implementation. And that's been really pivotal, ensuring that has success. So start early with the teams.
Great, thank you very much. As I said, we have had a couple of questions in. So the first one is from Sylvia Stevenson, and she would like to know where equality, diversity and inclusion fits into the future digital strategy. So that's obviously another big area. Is there anything specific, I guess, in the framework, or is it, I suppose, is it the idea that it cuts across anyway? I guess, Natasha, that's probably one for you.
Thank you, Steve. And thank you, Sylvia, for the question. And it's a really important question that I'm going to answer from 2 perspectives. So I'm really underpinning this equality, diversity and inclusion question is social justice. So really, that's what we're aiming for. And if we think about the 2 groups that I'd like to focus on are users, so patients and people, and then our staff. In terms of where this fits in this guidance, I would say it's woven throughout, but it's really important, and I am increasingly learning how much you need to tease it out and focus specifically and relentlessly on it at all time, because there is risk if you don't, that you inadvertently exclude and don't deliver our ambitions for both our people and patients and for our staff. So in the Phillips Ives review, we have called that out as a very specific theme to address. If I come to our workforce, it's really important that they all, as we are building this new career pathway, that everyone has access to it. And we need to pay particular attention to people from minority groups to make sure that they really are having access, which is why we've been having a series of roundtables around that for the review, and have one very dedicated specific one to delve more deeply, because what I notice is people find this quite a difficult thing to talk about. If we then come on to thinking about our patients, there is the real risk with remote care, and wearables, virtual wards, all these technologies that we may inadvertently exclude people. But there's also an opportunity to be even more inclusive and give people the care they want in the place they want to receive it, often their home. So in all digital transformation programs, we bring a patient voice. I think Andrea should also chip in, because she was leading our design of this, and as she said, she had patients in the group, and I'm sure Andrea Ronke wouldn't have let you get away without including EDI, because I know how passionate she is about it too. So perhaps you might like to tell us a little bit about how it worked in the development of this guidance, where it isn't called out specifically but is fundamental to it.
Yeah, absolutely. Thanks, Natasha. So we were going back to the formulation of that delivery advisory group. We were really, really key that we had to have, that whole equality and diversity piece was absolutely inclusive. And so actually we that was probably we did this guidance within 6 months, incredible timelines really, but we paid particular attention to that aspect in order to get it right. And it proved to be a great success, really, really fruitful, and great success in, as I say, shaping the guidance and that input that we had. And then also the patients, indeed, that was key. And again, they were valuable in the feedback that they gave us. They were involved in the formulation, but also, again, just the final sort of sanity checks on all of it. It's a really important piece of work, and there's lots going on. But just to reiterate what Natasha says, the guidance, it's a thread that goes throughout the guidance, absolutely.
Great, thank you. And thank you for that question, Sylvia. Great question. One from Ellen Edwards, who I suspect probably is in Wales. Obviously, we've been talking about England, but she would like to know if you are engaging with Wales. So I guess talking with colleagues in Wales and the rest of the UK, in fact, as well, about the digital agenda in nursing.
This is a global issue. Nursing is nursing. We need to work as a global community. So I'm going to start wide, and then I'm going to come to our devolved nations. So through the Phillips Ives review, we have deliberately constructed it with international and national experts, including experts across our devolved nations. And also in terms of how we inform our wider programme of work, including how we develop through the practice domain our nursing standard or functional needs standard. We have an international advisory panel. So we're bringing a real global community and a global perspective to the work. And interestingly, or probably very unsurprisingly, we have the same challenges. Some people are a bit ahead on something and others on other things. So working together enables us to do that sharing. We have a devolved nations CNIO, national CNIO group, who advise our chief nurses, and I meet with them regularly. So we work collectively on shared ambitions, but deliver them specifically for our own nations. So there may be some difference in what we do, but we're always aligned and learning from each other's work. And a real example of that is with our Welsh colleagues. They have already developed a national documentation standard for Wales. So we've worked really closely with them to understand that work in order to inform our own work. Great.
So thank you very much, Ellen, for that question. I hope that answers that one. I think we've pretty much come to the end already. So that flew by. Got a few seconds left. So I'd just like to say thank you again to Natasha and Andrea for such a brilliant session. Thank you for answering all of our questions and also such a great presentation. Next, we have a positive example on connecting stakeholders to optimize digital transformation. So I'm going to be delighted to welcome Emily Brown, who is Associate Dean for Innovation and Enterprise at Staffordshire University, who will tell us more.